So let's do another fat grafting fact. How big can you go if you have breast fat grafting? With an implant augmentation, you can just choose your size. You can pick exactly the implant size you want, and that's the expectation for after surgery. But with fat grafting, it's a bit more complicated. You really have to consider when you're having fat grafting, how much of a place do you have to put it, and how much fat do you have to take to place in your breast. And so lots of women who have breast augmentations are typically quite small, and there's not a lot of place to put the fat. And if you overdo it, you have higher chance of fat necrosis and healing problems. The other issue, of course, is donor site. So if you don't have an area to take fat, then you don't have an area to take fat. You're not going to get enough fat to increase your breast size, and you run the risk, if you're doing liposuction in areas that really don't have excess, of having lumps, bumps, contour deformities, and then you're causing a problem trying to solve a problem, and I don't think that's a good idea. So for most patients I see in my practice that want a breast augmentation by fat grafting, it's pretty reasonable to expect a half a cup size to a cup size increase with one surgery. Now, there are some patients who do more than one surgery, and if you have enough donor site, that's certainly a reasonable thing to do. You will unfortunately see people recommend weight gain, so 20-30 pounds to make your donor site better if you don't have a lot of fat around your body. I find this problematic. First of all, it's not great to gain that much weight when you're at a healthy, stable weight. I don't recommend that. I don't think doctors in general should recommend that. You have to remember too, when you gain weight, you're not growing new fat cells. The ones you have are just getting larger. So presumably when you move those fat cells to your breast and you get back to your baseline after surgery and you're back to your normal weight and eating habits, those cells are just going to shrink and you really didn't improve your outcome. The problem I see is that this is recommended commonly for women who are not good fat grafting candidates. And what ends up happening is when they get back down to their weight, they have lots of issues with contour deformities and irregularities in the skin of the liposuctioned areas, and then they often end up having to have additional surgeries, which they weren't expecting. So fat grafting is a great procedure. It's just important, like with any procedure, that you have an understanding of what the potential outcome is. So don't let some doctors swindle you and make you think you're going to be 3 cup size bigger. I don't recommend weight gain for this. It's a wonderful surgery. It has wonderful results, but you really want to make sure you're having it done in the right way to minimize the chance of fat necrosis and contour deformities.